The term integrative medicine is relatively new. There has been a history of terms such as alternative medicine, complementary medicine, but those terms don't work so well because alternative suggests that there's only one choice, the good choice or the alternative choice. And complementary suggests something that's from the word complete, not complement, that it completes the therapy. It's something additional. It's like the sauce that goes on the meal. And neither of those really describe what integrative medicine is. Integrative medicine is a philosophy of healing that includes a preference to use non-invasive therapies and therapeutic lifestyle changes that seem to enhance our body's innate ability to heal. And so we begin with usually things that relate to your lifestyle, your nutrition and diet, whether you exercise or not. Could that have an effect on the problem that you're having? Do you sleep? Do you manage stress? Are you exposed to toxins? What are your habits? How do you live your life? These things are as important to us in preventing a condition and in treating a condition. So we begin there, and so you get modalities such as acupuncture, chiropractic, various forms of massage and body work as the first line of treatment. I think this sort of medicine lends itself to chronic conditions, to things that just don't go away, that need to be managed, that need broadband, that need multiple channels, that need to look at the whole healing environment, not just the magic bullet. So it's really a philosophy. Integrative medicine is a philosophy or a style of practice. What's different about us is we are a clinic that is right next to all the other physicians in the hospital and in the building we're in. And we write our notes right on the electronic medical record. So there can be a note from brain surgery and then endocrinology and diabetes and then the acupuncturist. And then maybe my note about alternative approaches or integrative approaches to the problem that we're dealing with. That is fantastic for us, the idea that we can be right there. We also know that what we do in our little clinic can't possibly take care of all the needs of various patients. If someone has rheumatoid arthritis, we will tell them, now, when we're done here, make sure you go back to your rheumatologist. And your rheumatologist, by the way, if they're at the Brigham, can read the note of what we've done here. And also, I'd like to know what your rheumatologist thinks about X or Y. Or maybe you should go back to the physiatrist, and maybe you do need a spinal injection, and then come back and we'll work with you more. We love working with the other modalities. That's why I don't like the idea of the word alternative medicine has been used. Alternative, again, suggests either or. You can do this or you can do that. We do combined. Every clinic has specialties. I think ours, if you look at what we do and most of our patients, we deal with low back pain and other musculoskeletal pains. And we've become pretty good at pain management without drugs. There's no medications given. And low back pain is particularly well managed because we have 3 really good chiropractors right up front. Chiropractors start the ball rolling partly because they're expert at doing this. They've all studied NCQA, National Quality Standards, for management of back pain, so they know how to do it right. They're all experts at the spine, and they're covered by insurance. So a person can come in with just hurt themselves shoveling snow or lifting a heavy weight, hurt their back, get what is an amazing chiropractic visit. They think it's going to be 2 minutes and they think you just get snapped. A chiropractor will do a full neurologic exam, full history, and then begin to work with you and show you how to use your body better and then do some adjustments if they're needed. It's an amazing science of back pain. And we'll always refer when that needed to a surgeon, to a physiatrist. We love working with the other modalities if what we're doing doesn't work. One of the things we're excited about, and we hope there'll be more of, is we are part of a big research project. There's one big one going on now. It's a 5-year project looking at people with low back pain, since that's one of the things we think we do very well. Looking at us, it's an observational study. We're just watching 150 people, in a row that come in with just the complaint of chronic low back pain. And we're going to compare them to a group of 150 other people over the last couple of years that walked into the Brigham and Women's system with the same diagnosis. So it's sort of a cohort comparative group. And we're just going to see usual care, the other 150, versus what we do. How do these people, what are their outcomes? What do they think about their therapy? How much money are they spending on therapy? How much surgery do they need, et cetera? So that's one of the giant projects that's been going on now. It's getting near the end. We're almost up to have recruited 150 of each, and we're looking for more studies next. I think looking forward into the future, the promise of this kind of medicine is even better, because we're now looking at the fact that if we just simply practice mechanical medicine and replace the parts, we're going to run out of money. We just can't do that. We need to prevent. We need to find ways to get people to prevent an illness before it develops. And when they have an illness, we need to get them to take care of themselves first and learn how to take care of themselves. And then we want to save those fancy procedures for last. So I think in the future, if we start to look at our limited resources, we're going to find this back to basics, down to earth medicine that really pushes self-care and education and prevention is going to be very valuable.